Hello and welcome. This is Deepak Mishra and I welcome you to this channel. In this video, we are going to talk about questions that have been asked on the Facebook group International Doctors in Germany in last couple of days. I had invited questions so that I could collectively answer all of them. I initially thought I should write in a response, but then it was very lengthy process and would require lots of effort. So I thought rather this is a better way and more efficient way where I could, in a better elaboration and explanation, tackle those questions. So see, first of all, we'll talk about a Weiterbildung called Notfallmedizin. Notfallmedizin is a German word for emergency medicine, basically. Emergency medicine is a residency program in itself in the US and many other countries. That is the question is here. Is there a Weiterbildung in Notfallmedizin in Germany? If yes, how to get in? And then the next question is that, I'll take first this question. Isn't there a Weiterbildung in Notfallmedizin? Weiterbildung in Notfallmedizin is there. But it is not like what we know of a 3 years residency or 5 years residency. It is an additional qualification, Notfallmedizin. That means you will have to do some branch, and Notfallmedizin everyone can do. Everyone, as in all clinical people in clinical branches, they can do. For example, as a trauma surgeon, orthopedic surgeon, have done Notfallmedizin already. Somebody who is internist can do Notfallmedizin, anesthetist can do Notfallmedizin, neurologist can do Notfallmedizin. So anyone, there are requirements for that. Who has requirements are that you must have done 2 years of work, clinical work in the hospital, must have done 2 courses, like one course, 80 hours of Notarts course it is called. Then you must have done 50 practicals, 50 cases you must have seen with another Notarts, and then you have to take the exam. So there are requirements. I made a video about that with more specific details, and that is Notfallmedizin. After you take the exam, you have the Bescheinigung, a certificate of emergency medicine. All right. So that is, but it is not a full Weiterbildung in itself. That means you cannot just say that you are a emergency medicine doctor. It's not like that. In Germany, we don't have that. All right. So that is one thing, that you'll have to do some other branch, and along with that, you can work. Obviously, managing emergency is part of it. See, what happens, the difference between the system in the US and in Germany is that their emergency medicine means anything that is trauma or anything that like in emergency also, different branches all comes to the emergency medicine first, and the emergency medicine triages and then sends them to different specialities. Here in German hospitals, during emergency duties, every branch has their team. That means for a trauma, there will be, if there is a case history of, say, fall, the internist will not see the patient, will not go to the internist, because there is a trauma surgeon on duty. He will see directly. Similarly, when somebody is with chest pain, so the trauma surgeon has nothing to do with it, will directly go to the internist. And when they feel that, okay, this came as, for example, chest pain, but it is because maybe a rib fracture, patient also had fall after the chest pain or before the chest pain, depending upon the case. So in that case, you will be, as another colleague will be asked to help as a consult, but there is no one person who manages everything. Everyone has their own departments, and so the requirement for the extra person who is the emergency medicine person who will manage emergencies and then triage and then send it to different departments is actually not there here. So they have made a different system. All right. So that was about Notfallmedizin Weiterbildung. It is Zusatzweiterbildung. Zusatz means additional qualification, additional Weiterbildung, additional qualification. Okay, so it's not a primary qualification. All right. So going to the next question from the same colleague is that, when I apply in a hospital in order to get a job, I do it in a quality of assistant arts or what? Yes, when you apply for a doctor's job, doctor resident is assistant arts, so you apply for assistant arts position. Do I apply for a job in the field where I want to do PG? Or, for example, I want to do emergency medicine, I have to apply for emergency. See, as I told you, I understood the question. I told you that you cannot apply just as emergency medicine because there is no training for emergency medicine. You will have to apply, for example, as you have written in your question, you apply for internal medicine or cardiology or gastroenterology or neurology, any other branch, or orthopedic if you are interested in surgical branches, or general surgery, any branch. And apart from that, you can do, as the time progresses, you can do your Zusatzweiterbildung in Notfallmedizin. But later on, if you choose that, okay, I just want to do emergency medicine, then you can do that. But then your job prospects will be reduced because, as I said, that many times hospitals don't prefer that kind of. But there are very lots of flexible systems in different hospitals. So every doctor will have a job. So that is not should not be the matter of worry. But then this is not a standard way. So yeah, that is what I wanted to say about this thing. Do all my documents need to be translated by a certified translator or only diploma? All the documents that are not in German language has to be attested first from your German embassy near you, and then translated from a court certified translator from Germany. All right. Do I need job contract to apply for Berufserlaubnis? Ideally, yes. If you have a job contract, then that is the ideal situation. But most people don't have job contract when they apply for Berufserlaubnis, okay? Because you will not get a job contract because the employer will say that, okay, you need to have a license before I give you a contract, because he cannot employ somebody who is not a doctor in Germany, okay, the employer. So they will ask you for the license, and when you apply for license, they will ask you for the job contract. So it is the case of the chicken and the egg, what came first kind of situation. So here, that is ideal situation, but most states, they don't wait for job contract or like put pressure for job contract anymore. They are satisfied with a promissory letter, Einstellungszusage, or some hospitation, or if you live in that state. So those kind of things, they have become little lenient now. They're understanding that a job contract asking is not like a very practical thing to do. So yes, but if you have it, it's ideal. But most people don't have it, understandably, and so you don't need a job contract. Well, then moving ahead to the next question from the next colleague writes, how do I approach a hospital for hospitation with an FSP exam date or for a job after the exam? I have not understood what is the question actually from this, because but in general, I would say how to approach is obviously you write an email to them. The best approach is you apply them as soon as possible. You approach them as soon as possible. You don't wait for anything. Okay, here apply for hospitation. For hospitation, basically there is no requirement, right? For particular things, for job, for license, there are certain requirements you need to have. For example, a job, you cannot, if you're applying for a job without having a B2 in your hand, then obviously it's not going to work out, right? Because B2 is the minimum requirement that one should have. But hospitation has no requirements. So in whatever stage you are, if you have FSP exam date, you don't have exam date, whatever it is, you are in India or in your home country or in Germany, and if you want to do hospitation, you can apply for them, approach them for hospitation. So that is my, in general, suggestion here. Okay. Next question is, should I translate my educational documents to German language? They are all in English. Okay. Yes, obviously. You have to translate all the documents that are in English to German, except the curriculums. Curriculums are booklets, 20, like some are 200 pages, some are 150 pages. So if you translate those documents, maybe someone might go bankrupt because translation is quite expensive. But that is not required. That booklet can be submitted in English. English is accepted. But apart from that, other documents which are there have to be translated. That too, not just by any translator in your country, by a court certified translator in Germany. As you live in Frankfurt, so you will have easy access. You will find a translator nearby. Many in Frankfurt. All right. Next, there are many questions from one of our colleague here. Around 12 questions he has posted. So I'll take one by one. First question. So do we have to apostille the certificates before coming to Germany or after coming there? And what are the documents to be apostilled? Big interruption here. Don't apostille. Don't apostille. Apostille from Germany and India, they do not have that contract which agrees to accept each other's documents. So if you're doing apostille, you're spending money, you are wasting money, and you're wasting your time. Please don't do that. Apostille is not required. Okay, it is not, even if you do it, it is not valued. So again, you'll have to do the entire same process. So you can just save some money and time for the apostille process. All right. So the question, the same second question was agency for apostillation. As I said, no need for apostillation. Otherwise, apostille is done by the External Affairs Ministry. In India, it is in Delhi. What is the time taken for processing apostillation translation? Again, no apostillation. Translation might take a couple of weeks depending upon how busy the translator is, but apostille you don't need. Will the embassy help you in this regard? No, embassy will not help you in this regard. Why will the embassy help you in apostillation? Apostille, embassy has nothing to do with it. Apostille is done by your country. That means if you are from India, which I assume you are from India, you have to do it from your country's External Affairs Ministry. German embassy has nothing to do with it. And about translation, they will give you a website where you will find the list of translators. So there also embassy will not worry or help you in these matters. It is not the matter for embassy. How much cost is incurred for these? Apostille is expensive, as I said. Each document used to cost 2,000 rupees, Indian rupees. At present, I'm not updated because it's not required. Why would I focus on that? About translation, the fees are different. You might find people from 30 euro to 50 euro per document. So yeah. The same person writes further, sir, what books do you recommend for FSP and approbation, and do those books cover basic language? See, you have to understand here, FSP and approbation are medical German and medical knowledge exams. Okay, so they will not cover your basic language. It's like studying anatomy books and expecting learning English from that. So it is not anatomy. You have to learn the language first. You have to reach up to that B2 level. That is how it is structured, that you have to complete B2, and after that you have to complete your basics, and after that focus on your Fachsprachprüfung FSP and then Kenntnisprüfung. So you cannot expect that with your FSP course or FSP books you will learn the basic language. For that there are separate courses. It takes around 6 to 8 months till you complete that. So that effort has to be put. All right. Books do you recommend for FSP? So nowadays, every 2 months, new books come up. Okay, so when I prepared for my exams, I studied for Fall book. Then came MEX, the MEX series. Now they have this Frage und Antwort. And so there are many books nowadays. Ambos is one good source that I always recommend. Now it has become a little expensive. One should think if there is possible collaborative effort, as in multiple people take subscription and all. So those kind of things. So those are good sources. And nowadays, as I said, I will research what is the latest about books, because I have stopped teaching. I made online course 2 years, like 2020 it was. That time I updated all the information. Since then I have myself not checked which latest books are there in the market. So but every 2 months some books come up. All right, so I cannot give you names. A couple of names I already gave. For FSP, there are Communication, Ausländische Ärzte und Ausländische Ärzte. That is one book. Then there is Deutsch für Ärztinnen und Ärzte. That is one good book. So these are the basic books. So standard books. There are 2-3 standard books which everyone uses for the Anamnese section, for history taking section. All right. If I find any, I will link to this video. Then I put it in the description. Okay. What documents needed and time taken for blue card visa and its approval? Documents needed. whatever documents you have basically. So your passport will be required, your address proof, your there is a list of documents, the salary structure, your I mean the what you say, employment contract will be required, your health insurance will be required. So there's a list of documents. You have to check that there's a 10-12 documents that you require for that, for blue card. Most importantly is that job contract. You need to have a job contract to apply for blue card. Okay. Approval takes a couple of weeks, and like within 4 to 6 weeks you get that card in your hand. Okay. The same person further asks, if suppose I'm working, do we need to show leave letter for visa? Yes, that is a good question. Yes, you will, depending upon which kind of visa you're applying to. If you're applying for Schengen visa, you'll have to show that, okay, you are going to come back. If you're applying for a long-term visa, that means a national visa, a 16D visa, then you are saying on your side that, okay, look, I'm looking for my professional qualification over there and I would like to take up a job over there in future. So then if you don't have leave in, if you say that, okay, I've quit my job, then that is also explainable, that is also understandable. So I think in that kind of visa, you don't need a leave letter. Otherwise, for short-term visa, for Schengen visa, where you say that, okay, I'm going to come back, that time you have to leave letter and NOC you will require for someone who is working. All right. So agency to translate the documents, and what are the documents should we translate? All the raw documents, there is another video where I have talked about requirements for application for Berufserlaubnis and approbation. Okay, in those documents, in that video, each and every document has been explained in detail. So I would suggest you or request you to go through that document so that you can like arrange your application. Here, to translate the documents, there is a website called, I will put it in the description. There you will find a huge number of translators in Germany. All right, so you can contact one of those translators and get your documents translated. All right. So how much time does it take to get residence permit and what are the documents required? See, here you asked in question number 3 about blue card visa, and then in question number 6 resident permit. Both are the same, so my answer applies to this question as well. 7th, if married, are there legal closures to be made? What does that mean? I did not understand legal closures. About if you are married, you will need a marriage certificate, and marriage certificate too will be legalized. That means that will be verified and everything, so that your spouse can also in future after a couple of months come to Germany on a family reunion visa. So a marriage certificate will be very important, and it also will be verified. How to plan job and cost of living accordingly? It's a very broad question. How to plan job and cost of living. Cost of living you can plan by spending less, yeah, and plan job is to search actively and intensively. Okay, then we will go to another person. He writes, he asks about different types of hospitals in clinics in Germany with pros and cons. Yeah, that is a good question. I think I can make a separate video about it for YouTube. Different kinds, we can classify the hospitals as the big ones. That means like Universitätsklinikum, more than 1,000 beds are big ones. The medium ones are 400 to 600 bed hospitals are the medium ones, and less than 300 bed or less than 400 bed hospitals, you can call them as a smaller hospitals. These are the structure of the hospitals. Okay. Then there comes REA clinic, that is rehabilitation centers. That is also, it's not an acute clinic, but then there also doctors are required. Okay. So REA clinic is there. Then there is a private praxis. Praxis means like you have a consultation basically. So that kind of setups are also there. So there also some time of your training can be spent over there. Some people have those authority to train. So that is the pros and cons about these. Every place has pros and cons. Talking about from the biggest centers like University Clinicum and all. So those pros are that there is a huge public. You get to see lots of different things. The best of the in that area and in that state or in that city is seen at the Universitäts Hospital, Universitätsklinikum. So that is a pro, that you have a huge exposure. Con is that you get lost, because in that team there will be 20 assistant arts or 25 assistant arts, so it might take few months that people actually get to know your name, like and try to that way it is. So in that way, people will not be knowing you, you will not be supported. It is be expected that you do things on your own, and people are also competitive at such competitive positions. So that way, as a newcomer with a broken language, if you don't have work experience, then the knowledge, the work knowledge is also less. That way it becomes very difficult at the university hospital. Okay, but if you survive that, then you learn very fast. All right. Surgical branches in general, I mean, I cannot generalize all hospitals in that, but in general, it is said that university hospital, you start operating little later. Okay, once you become almost FACAs or FACAs, then you operate more and more. So this is that is now what I have said as the cons for university hospital, big hospitals, becomes the pros for the smaller hospitals. And pros for smaller hospitals means there you have a team of say 5 to 7 residents, 2-3 oberats and one chef. You have like 30-40 patients. So you regularly do things, you are supported. Many times it's also like that the situation is very chaotic, because smaller place, less structure, less people, because private hospitals, they don't employ people very readily, so that they can save on the salary. So you are overworked. So it depends. Sometimes if you're in luck, you will have good team, they will also support you. Sometimes they will find you as a burden, because they hired you to take the work and do it on, like, reduce the workload. And if they had to keep teaching you and supervising you all the time, then that workload, like, is the burden is there on them. So it can work both ways. That's why initially one does not have much option or choice, so one takes whatever he gets. But yes, slowly one starts talking to different people, networking, and then finding how the team is, and then team, how the atmosphere, the work atmosphere is. That is very important after a particular stage. So initially we don't think much on these things. For us it is like, okay, let's see what happens, I mean, we'll manage. But later on, this fine things also play a role. All right, so these are the about Rhea Clinic. Life is much nicer in Rhea clinics. It's a very good place actually to start, because you have peace in your life. You can study for your Kenntnisprüfung. The salary is almost the same, so that way there is no problem. Also, you're learning new things. So that way, to learn new things, Rhea clinic is also a good place. But I still don't always recommend Rhea clinic, because the exit or the entry from Rhea clinic to acute clinic or hospital, it is little problematic. Problematic as in it's a totally new world in the acute hospital when you come from a rehabilitation center. All right, so it's a good place to begin with. But if possible, go to a smaller hospital. That is the most where you also stay in the clinical touch. That means you see actively patients. If in surgical branches you actively go in the operation, so you play the game that you want to play for a very long time. In Reha is a totally different thing. It is more laid back and more good to learn, but the learning is little slow over there. All right. Then the next question is, hi sir, I applied for language course visa for FSP to KP course at Chennai consulate, but I received an email from Central Visumbearbeitung. I have to submit Defizitbescheid or Zwischenbescheid to proceed further on, as the language course visa is only applicable to. See, yes. In your case, you cannot do much now. They have asked for Defizitbescheid. You will have to wait till you get your Defizitbescheid. Okay. Or if you have if you get, yeah, if you have not got Defizitbescheid yet means it will take some time till you get your application, I mean the appointment for the exam or FSP and all. If you had the FSP appointment, then that could be one reason why you want to come to Germany. But since you don't have that, you'll have to just wait here, because there is no way out. They have asked for Defizitbescheid, you have not gotten it. That means you have like recently sent the application to Regierung Oberbayern. You'll have to just wait some time, some patience. Next question, any good language course suggestions? Well, we have our language institutes. They're also good. I mean, language institute where we have teachers. We conduct online language A1 to B2 level classes. And now we're also starting with live FSP training. So yeah, so you can contact our team or check out our website for language courses. Any website for job search? So there are many websites. I mean, there is Indeed.com or Praktisches Arts. So if you just Google Assistant Arztstelle in Deutschland, there will be many websites that will come up. So that should not be the problem. The next question is, ideally after how many months can I clear my FSP exam after arriving in Germany? How hard it is to get a job immediately after FSP exam? See, immediately after FSP exam, the job search process in itself take couple of months. No, you have to send application. After a couple of weeks, they will see your application, get back to you that okay, we would like to meet you. Then you fix an appointment after a couple of weeks. Then you go there. They take few weeks to get back to you or give you sometimes they give you immediately as well, but sometimes they say that okay, we'll get back to you in a couple of weeks. So the process of job search itself takes 2-3 months. So one should not wait to pass the FSP exam to begin the job search. Job search has to begin they started right at the beginning, and FSP has to be one aspect that okay, that is pending, that is not there. That means the employer or the person who's interested in employing you also knows that okay, this person's FSP is on this date. That means if that she passes that, then next day I have a doctor in my hospital. So, and how many months can I clear after arriving in Germany? See, it has very little to do with arriving in Germany. It depends upon how well you are prepared. Okay. Obviously, I say that okay, it should not be that you have just come on Saturday to Germany. On Monday, you're taking the Fachsprachprüfung. You should spend some time. I would say a couple of months is a good time, but not couple of months sitting at home and talking to people in your native language, but a couple of months of active interaction, visiting some course, some hospitation, something in Germany. All right. So a couple of months is a good time, I would say. How do I translate my documents to German? What agency do you recommend for that? Which documents need the Hague apostille? How do I go about this? Again, apostille is not required. Okay. And how do I translate? So you have to find a translator who is certified by German court. You can find that the link for that I will be posting in this description of this video. You can go on the website, and there are around 4,000 translators I have found last time I was checking. So you can find one of those 4,000, ask them how much the fees is, the phone numbers given over, their email addresses given, so you can contact them and get it done. All right. Do we need to learn all medical terminology in German language, and do we have to take another course for that, or the FSP course would cover that? Also, to what extent is medicine in German and English the same? Okay. Do we need to learn all medical terminology in German language? Obviously, the medical terminology that you will be using, that you need to know in German language. You cannot speak any other language. English, if you speak English, you fail in your FSP exam. Okay. So do we have to take another course for a FSP course would cover that? FSP course, a good course would cover everything that is required for the exam. Right. Also, to what extent is medicine in German and in English same? See, English and German, they are not same, but since they all come from Latin and Greek and like old ancient languages, there is some similarity. Okay, but then that similarity will not be useful. Because the words, even though the words are similar, they are interchanged position. So it's like not directly English, but it's from the origins of Latin. So it does not make if they're similar. Does not make any difference if they are similar or not similar. All right. So don't count too much on the similarity between the two languages. Next question is: I did my BDS from China. I am registered in my country. What do I do now? If you're registered in your country, then you send your application for Berufserlaubnis and approbation after choosing one state in Germany. So that is the next step that you start. Yeah, before that, start German language courses. Okay, so because directly application does not bring anything if you have not even put one step. Do couple of levels so that you will have some idea. You can read some websites. You will know how to fill the form and all those things. So then you can send the application. And for BDS, we also have a course, like online course, the link to which will be there in the description, about the roadmap course, which helps through videos, guides international doctors and dentists, like the separate courses, who wish to work in Germany. So you can check out that as well. So the next question is, recently completed B2 level, what next? Could you guide me through step-by-step stages with regards to visa, documents, duration, exams, cities, how to minimize delays, and finally landing a specialty program for... Ooh, okay. See, I mean, the good thing that you are in this group, and here you will get lots of information. There are colleagues who will answer most of your queries as far as they are sensible, the queries I mean. So you ask your queries, whatever, and people will try and help you. I will also try my best to help you here. Otherwise, if I have made lots of videos, we have courses, you can enroll there. And for all these steps that you have talked, we have videos, and the details for personal consulting, we have a totally different program. So for that, you'll have to check our website. Okay, the next is, please, any masters in endodontics for 3 years duration, preferably English medium. See, there are MSc courses, okay, but MSc courses are then not clinical courses. The MSc courses you can have in English medium as well, but if you want to work as a dentist, as a clinician, then you will not have English things, and that is also not course. This is work basically. You get a job, you get a salary for that, and you work accordingly, and yeah, and so you complete your training. Please send me a link if for German medium. I'm not able to find any 3 years course of Endomasters. Since 2 years I have been looking, or any 3 years. See, if you have been looking for 2 years for a course and you have not found it, then it's very highly possible that it does not exist. So one has to accept that sometime. All right. If I want to do MBBS, the same person now asks about MBBS in Germany, but I'm a dentist already. Can I work as a dentist there plus go to classes only for MBBS? Theoretically, nobody can stop you from doing that, but how do you plan to do that? Because if you work as a dentist, that means you will be spending time in the clinic, in the practice, right? And the uni has lectures. So you'll have to, how will you attend that? How do you plan to do that? So think about it. Theoretically, it's possible. Theoretically, people who want to MKG chirurgy, Mund-Kiefer-Gesäß chirurgy, that is maxillofacial surgery, they need to have both diplomas here, both degrees basically, medicine also and dentistry also. So those people who have finished their medicine and now do dentistry, they get that. They get some discount as well, concession as well on duration, and but that prolongs. That is not so simple. So and yeah, that is very, very, very difficult. Language we need till B2 or C1. B2 is the requirement as per the law. C1 is preferred because most candidates who now apply have C1 already. So if you are the one who does not have C1, that means you have some negative like thing on your CV. All right. Then the same person asks further, after completing languages till C1, what exams do we need to do? I heard this is it's a registration exam. It's oral exam, right? It's an interview or viva, dental cases, definitions, etc. See, the first two exams are correct. First exam is the Fachsprachprüfung, which is an oral exam, correct? All exams are oral. In your approbation, you have practical aspect as well. That is true in your Kenntnisprüfung. but FSP is mostly like it is an oral exam. They will show you some X-rays and all those things like we have practical, but you don't have to do anything. All right. So yeah. So these were the questions that were asked in last couple of days. I hope I could put some value. And if you have more questions, you can put in the comment section of this video, and I will try to make more such videos where in a short time, I can share my thoughts about them. All right, have a nice time. Bye bye.